Hello, medical terminology students and Professor Baldwin. My name is Edson Pais, and I'm going to discuss TBI, also called craniocerebral trauma. TBI is defined as an external insult to the brain. It's not degenerative and it's not congenital, but caused by external physical impact that can alter or diminish one's state of consciousness, which results in impaired cognitive abilities and/or motor dysfunction. Different types of head injury are coup injury, which occurs on the side of impact with an external object. Countercoup is on the opposite side of the area that was hit. Closed TBI is when the outside force impacts the skull, but the head is not broken, fractured, or penetrated. Open TBI is when the skull is penetrated, broken, cracked, or fractured. Example, bullet wound. Brain contusion occurs when the brain tissue is bruised. Small blood vessels leak from lacerations. Baby shake syndrome is another classification of TBI. It occurs when an infant or toddler is forcefully and violently shaken. The most common occurrences of TBIs are attributed by motor vehicular accidents from ages 15 to 29. The second most common cause is falls, which happens to be the geriatric population, 65 years of age or older. Sports contribute 10% of the occurrences, and assaults contribute 12%. Prevalence continued. TBI is responsible for more deaths and disabilities than any other neurologic cause in the population under age 50. Males are twice as likely to incur a TBI, with the highest risk group being 15 to 29 years of age. Roughly 5.3 million Americans alive today have had a TBI. 1.5 million new cases are reported each year. 50,000 people die from TBI each year, and 85,000 people suffer long-term disabilities. To assess the level of consciousness, mental status, and severity of TBI, one could ask questions like, does the person respond to spontaneous, verbal, or painful stimuli? If the person is conscious, is their speech clear, logic, and organized? What is the activity level? What are the person's facial expressions? Highest possible score is 15, which indicates a person fully conscious. The lowest possible score is a 3, and this indicates that the person is in deep coma. Anything equal or below 8 indicates a severe injury. A score from 9 to 12 is moderate, and anything above 12 is minor. Characteristics that show after TBI: unequal pupils, motor problems, cognitive impairments, behavioral issues, cerebral spinal fluid discharge, raccoon eyes, short-term and long-term memory loss, confusion, weaknesses, dizziness. Medical management for TBI: surgery, resuscitation, management of respiratory dysfunction, cardiovascular monitoring, mechanical means to decrease intracranial pressure, neurosurgery to manage lacerated vessels and depressed skull fracture, antibiotics, anticonvulsants, sedatives, antidepressants. Tips to improve life after brain injury. After evaluation and diagnosis, the therapist treats the symptoms according to the client's impairments. Frontal lobe damage, behavior is affected. An example of intervention is enroll the patient in a social skill class to relearn activities of daily living. Posterior lobe damage, hand and eye coordination exercises, like shooting a ball or using a manipulation board to regain sensory and motor function. Give activity that is important and that is fun to the client. Not only focus on the motor and sensory aspects, but also the mental and emotional well-being. People who have acquired traumatic brain injury will need rehabilitation. It usually starts in the hospital and may continue on for months, even years, depending on the severity of the condition. Types of therapy may include physical therapy, which promote the ability to move, reduce pain, restore function, and prevent further disability. Occupational therapy, which helps regain the maximum level of independence through interventions that center on activities required in daily life. Speech therapy addresses speech, language, social communication, cognitive communication, and swallowing disorders acquired during the injury. Psychotherapy overcomes problems and fixes behaviors. References.